to my colleagues that you are coming to the studio, everybody who was there in the studio with me at that point of time said, "Hey, I have a joint pain. I have a joint pain."
If you consider joint, whether it's a knee joint or hip joint, which is a weight bearing, your body weight goes on that. This age group belongs to what we call a traumatic joint pain.
Welcome to Health Inside Out, a Kauvery Podcast.
Thank you so much for joining us on Fever 104 FM. This is Cheyenne on the Superhero Show, and it's time for Health Waves from Kauvery Hospital. Joining me is Dr. Raghu Nagaraj. Sir, this is the second time you've come to the Fever Studio, and I want to welcome you once again. Thank you so much for taking time out of your extremely busy schedule and being here.
Hello, Cheyenne. Thank you. Thank you for having me on here. Yes.
I would like you to once again kindly introduce yourself for our listeners so that, I want to get your designations right. So, better it comes from you.
All right, surely, Cheyenne. So I'm Dr. Raghu Nagaraj. I'm the Director, Department of Orthopedic, Sports Medicine and Robotic Joint Replacement Surgeon practicing at Kauvery Hospital Bangalore.
See, it was very difficult for me to remember all of that. I would have missed out a few key details. Thank you so much for being here. Let's straight away dive into the interview. There are a lot of important questions that people would want to know about, and one is about joint pain.
Yes.
When I mentioned to my colleagues that you are coming to the studio, everybody who was there in the studio with me at that point of time said, "Hey, I have a joint pain. I have a joint pain." So that's something that everybody experiences at some point or the other. Can you highlight some of the common causes of joint pain and why do they affect so many or everybody of us?
Yes. Cheyenne, if you consider joint, whether it's a knee joint or hip joint, which is a weight bearing, your body weight goes on that. So basically, it's taking the brunt of your body weight. And compared to other joints like shoulders, you have a wide range of movements in the shoulder joint. So all these comes with the certain cost, like repeated wear and tear of the knee joint, or with extreme movements of the shoulder joint, one can tear their tendon in the shoulder. There's so many reasons for the joint pain. If you talk in terms of the age group, like suppose between 20 and 40, who are physically very active, who are involved in one or the other kinds of sports activities, they develop joint pain mainly because of the injuries. It could be a small twisting injuries, repeated one, or it could be a major twisting injury, either because of the contact with another athlete or a simple loss of balance. So
Okay.
this age group belongs to what we call a traumatic joint pain, where one or the other structure around the joint, it could be a tendon, it could be a ligament or a meniscus or a cartilage. One of them could have been damaged, and that results in joint pain. If you consider a senior age group like 45 plus or 50 plus, they generally develop joint pain is because of the age-related degenerative changes. Basically, over years of their life, they have used their joint so much that because of the wear and tear, they develop joint pains. And certain other conditions, what we call as an inflammatory arthritis. In this group, they develop joint pain because of sudden onset of swelling and pain in their joint. It could be due to certain factors in their blood which goes very high, like a rheumatoid arthritis, or it could be any other autoimmune, where there is certain role of family history playing there. They would have had either grandfather or grandmother, one or the other person would have had joint pain, and that will pass on with the genes. So that's what we call as an inflammatory arthritis. So there are so many reasons according to the age group and according to their physical lifestyle.
Now, there are a lot of these new treatments that we all keep hearing about, PRP therapy or high tibial osteotomy.
Yes.
Am I pronouncing that right?
Yes.
It's a difficult one to pronounce.
Yes.
Can you tell us what are these and, what makes these treatments effective?
Yes. See, what happens is over a period of time, our advancement in technology and science has come so far that we can treat every damages that's possible.
Okay.
Suppose if there is a small early meniscus tear or early arthritis, when we catch them at this stage, in early stage, we can treat them with PRP. PRP, what we do basically is we draw the patient's own blood and centrifuge at a very high speed. When we do that, so the blood gets separated into multiple layers. The topmost layer will have a very high rich in growth factors. So when we inject that particular layer into the joint, it helps in regenerating the tissues which has been damaged. But yes,
Okay.
it's a simple procedure, daycare procedure like it's done in a OPD. But yes, the provided the patient's diagnosis is done early. That means whatever the damage, if it is
Early
treated at
stage.
an early stage, then PRP works well. Coming to the high tibial osteotomy. See, what happens is basically certain patients develop malalignment. That means when they stand, the body weight from the hip to the ankle goes into any one corner of the knee, either inner part of the knee or outer part of the knee. This is what you call as a malalignment. This
Okay.
generally happens in early arthritis or because of their family history. So you would have noticed some people would be having bowing of the bones in the knee. When they stand, the leg would look either bowing
Right.
or it would look like a knock knees, like going away from each other, where the knees rub against each other.
Right.
This is what we call as malalignment. So in these kind of people, if we do a high tibial osteotomy, high tibial osteotomy means basically we are correcting the alignment back. So below the knee, we'll make a small cut in the bone and make the knee straight and fix it. So when you do that, when they stand or when they run or do any physical activities, the body weight will go in the center of the knee joint. So that prevents the progression of arthritis. Basically, high tibial osteotomy is indicated for people around 40 to 50 age group with early arthritis and having a malalignment. That means when we do a scanogram in standing position, the body weight should be going in eccentric position, either onto the inner knee or onto the outer knee. These are an ideal patients who will need a high tibial osteotomy. This is basically done to prevent the progression of arthritis and also to keep them physically active. So once we do that, they can go back to their active lifestyle. They can run, they can play, and they can do any sort of sports activities without damaging their knee.
I will ask you an additional question here. Does it also come in for, sometimes let's say I have injured one leg.
Yes.
Then the other leg or some knee joint or ankle joint is taking additional weight. And because of that, we develop pain there as well.
Yes.
Is high tibial osteotomy effective in those cases as well?
Yes, definitely. Because see, when you neglect a ligament injury on any one knee for quite long time,
Right.
that knee goes in for a malalignment. Slowly over a period of time, it starts getting bent. So the body weight will start shifting towards one corner of the knee. So because of which the opposite leg will start taking the brunt. That gets overcompensated and that starts hurting. But yes, two things will play a role in this kind of situation. One is we have to correct that ligament back into proper position by doing a simple arthroscopy or a keyhole surgeries where we'll correct the ligament and also correct the alignment. Plus, we have to rehab the other knee. We have to strengthen the other knee more so that that can take extra weight. So if we correct the damaged knee plus over strengthen or rehab the other knee, then patient can definitely go back to their normal lifestyle.
All right. You did speak about meniscus tears earlier. That's something that we read in newspapers quite a lot. A lot of athletes have it. Can you tell us what is meniscus tear exactly? I mean, the name is self-explanatory, but a little bit about that. And how do you repair them?
Yes. See, Shayan, meniscus is the most important structure of our knee joint. Basically, it acts like a shock absorber of the knee. When you run or when you jump, your body weight is absorbed by the meniscus.
Okay.
So, in each knee, there are two meniscus. One on the inner part of the knee, what we call as a medial meniscus, and one on the outer part of the knee, that is a lateral meniscus. These two meniscus acts like a shock absorber, and that's what keeps the knee smooth and normal. So, sometimes in athlete, like suppose if the person is involved in any sports activities, it could be a contact sports like a football or a non-contact sports like a tennis or badminton.
Right.
When they twist the knee or when the body goes in a wrong direction, so the cushion gets crushed between the two bones, and that's when they develop a meniscus tear. So when they develop a meniscus tear, generally the symptoms are not so dramatic like a bone fracture or a ligament tear. It's a small niggle that continues to persist. So they will have a certain symptoms when they do certain activities like sitting and getting up or while playing sports. It's a niggle that will bring down the athlete's performance. So slowly their the ability to do sports will slowly keep coming down. That's when they should take a note of it and come and meet us. So when we diagnose that meniscus tear, generally we need an MRI scan to diagnose that because it's a soft tissue structure. It can't be seen in an X-ray. So when we do an MRI scan, we'll get to know which part of the meniscus is torn and how severe it is. As I said earlier, if it's in early stages, we can get away with PRP injections and a proper rehabilitation of the particular joint, knee.
Okay.
If the tear is grade 3 plus, then it has to be repaired. The repair, when I say that, it's a very simple procedure, what we call as an arthroscopy. It's like a keyhole. You make a two small keyhole around the knee and pass the camera, and looking in the camera, we repair every tear possible. Because now with our latest advancement in our arthroscopy techniques, we can repair all the type of tears. When we repair it, the meniscus will get the shock absorber function back, and athletes can go back to their active lifestyle. But in certain extreme condition where the athlete has lost a lot of meniscus because of the neglected tear or some in some part of the in tier 2 and tier 3 cities, some surgeons end up trimming the meniscus because trimming is easy than repair.
Oh.
So yes, because healthcare is not advanced in every part of the country.
Right.
In certain areas, they opt for a simple techniques like trimming. When they lose the meniscus, then chance of developing early arthritis is there. So if the person comes to us with the complete loss of meniscus and onset of early arthritis, now we do what we call as a meniscus transplant. We transplant a new meniscus back in their knee, like similar to a kidney or a liver transplant. But yes, having said that, it's not such a major surgery. It's a relatively simple procedure, and the acceptance of the meniscus transplant is very good. The
Okay.
outcomes of that procedure is extremely good.
Okay, so when someone comes to you with chronic joint pain, how do you decide which treatment would be right for them?
Yes, Shayan, that's a good question. So before talking about what is the right treatment, first we need to find out what is the reason for the joint pain. As I said earlier, certain age group are more prone for injuries, like younger age group between 20 to 40, 45, where they are very active on field in sports, or it could be any form of physical activities. It could be yoga, or it could be Pilates, or it could be Zumba.
Right.
So in this active population, the chances of traumatic joint pain is very high. That means there could be overuse of particular tendon, what you call as a tendinitis could be the reason for the joint pain, or it could be a structural damage like a meniscus or a cartilage. So one should be evaluated properly. So we have to run a comprehensive history taking and examination followed by a certain advanced imaging modality to find out what is the actual reason for the joint pain. So once we find out whether it is a traumatic joint pain or whether it's a degenerative, which is age related joint pain, or is an inflammatory joint pain like a rheumatoid arthritis. So once we find out, then we can suggest the proper treatment. If it is a traumatic or a structural damage joint pain, then we have various options like a good rehabilitation in early stages. If necessary, a simple procedure in OPD like a PRP or a stem cell injection. And in in patient with grade 3 meniscus tear or a grade 3 ligament tear in the knee joint, we can perform a minimally invasive keyhole surgery to repair all those structures. And the results of each of these procedures is extremely good. People can go back to their active lifestyle possible. And in certain alignment issues, when they have it, we can do an ITBL osteotomy and correct the alignment back. And in the cases where they are 40 plus and they've already developed arthritis of any one corner of the knee, then we can perform what we call as a robotic partial knee replacement. Only the damaged part can be replaced. This is to make sure that they continue to live their active lifestyle and also postpone the requirement of total knee replacement. So we have various options now. So according to the diagnosis and according to the age and according to the severity of the damages that is there in the patient knee, we can suggest a comprehensive treatment for each patient.
All right. When you talk about all these treatment options, and again, you spoke about various treatment options. What can somebody do? Let's say somebody who's listening to us on radio or watching this online, they've gone through a procedure. What can they do to get back on their feet faster, or use those joints, and just get back to fitness faster? What do you suggest?
Yes. See, my suggestion to such patients who have undergone some sort of surgeries to correct their ligament or meniscus issues,
Right.
they need a good rehabilitation program. Yes, you have to follow a structured rehabilitation program.
Now, when you say rehabilitation, what does that exactly mean? Does it
Yeah.
mean strengthening the muscles around that area? What does it mean
See,
exactly?
rehabilitation has a different phases.
Okay.
Suppose the first 3 to 4 weeks following a surgery is an initial phase of rehabilitation where we'll focus more on bringing down the pain, bringing down the swelling or inflammation in that procedure done joint part of the body, and getting the movements back. As they slowly regain their movements back, which may take 3 to 4 weeks from the surgery, then we will put them on strengthening program, which will take another 4 to 6 weeks period. Once they cross 6 to 8 weeks from the surgery, then we'll move them to an advanced rehabilitation, also called as a plyometrics or proprioception. We'll make them do a lot of balancing exercises. Basically, all these things is to improve the reflexes, also called as a proprioception of the joint. And by 5th or 6th months from the surgery, we subject them to what you call as a return to sports rehab, where we'll make sure that they would have regained their complete strength back, reflexes back, and also balancing. All these things, once they satisfy the criteria, once they've gone through all the phases of rehabilitation, then that's when we allow them to go back to sports. And that's when it's very safe to go back to sports. Because a lot of the patients or athletes who undergo some surgery and then they don't do rehabilitation properly and then they return to sports, then there's always a chance of re-tear or similar issue recurring back. That's why it's suggested to go through a proper structured rehabilitation program to make sure that they don't end up in a similar injury once again.
All right. I'm sure there are a lot of myths about, joint pain treatment. What are some of the myths, and if you would like to clear them up?
Yeah. See, one common myth that I would definitely want to clear this on here is joint pain is not a permanent problem. Every patient, when they come, they think that once they develop a joint pain, they assume that it's a chronic issue and they got to live with it. No, that's actually a myth, because we can now treat every reason for the joint pain. If there's any structural damages like a meniscus tear or a ligament tear or a cartilage, we have various options now, starting from the rehabilitation, PRP injections and advanced arthroscopy surgery techniques to correct every structure that is damaged. So now with our technology and the advancement in our health with what we have, we can treat every joint pain and we can make sure that each patient can go back to their active lifestyle. They do not have to live with it. If suppose if the age is on a higher side like 55, 60 and the knee is extremely damaged, now we have the best procedure, that is a robotic total knee replacement. The outcomes are extremely good to each patient, and patient recovery is also much faster with this procedure. So yes, joint pain is not a permanent issue. It can be treated and it can be completely solved.
Wow, that's good news for anybody suffering from joint pain for that matter. Speaking about joint pain, speaking about Kauvery Hospital, I hear there is something exciting on the horizon for joint care at your hospital. Can you share that with us? I hear something grand is about to happen tomorrow.
Yes, Shayan. So we are launching our robotic joint replacement program. We have the world's best robot, that is a Striker Mako Smart Robotics 2.0. With this advanced technology, now we are delivering the best outcome possible for our joint replacement patients. So using this robo, we can perform total knee replacement, partial knee replacement, and also total hip replacement. And along with this, with our latest advanced arthroscopy techniques in our hospital, we are now treating every joint damages possible. Like I said, we are doing advanced procedures like a meniscus transplant, cartilage transplant, and also high tibial osteotomy. All these procedures are now being done so that any patient with any kind of injury, starting from grade 1 to grade 4 injuries, each one of them are treated in a comprehensive way, and we make sure that every patient gets back to their active lifestyle. So we now under one roof in Kauvery Hospital are catering to every population, every age group of population, and all sorts of joint related issues under one roof.
Well, that's lovely, and that starts up tomorrow itself for anybody listening in. Before we let you go, sir, you have a very busy schedule. For anybody listening in who is dealing with joint pain, if there is any one piece of advice that you would want to share with them?
Yes, one thing is, see, joints take your brunt of your body weight, so we need to take care of it properly. So my suggestion to all the viewers is do regular strengthening exercises. If your strength is good, that will enables the joint to enable us to do all sorts of activities. It could be cardio like running, jogging, any kind of sports activities, but joint has to be strong. The muscles around the joint has to be strong to prevent injuries. To do regular strengthening exercises around the joint, and also do regular stretches and warm up before you go and play any kind of sports. Because a lot of athletes, when we see with injuries, when they come to our OPD, we observe that most of them would not be doing proper warm up or proper stretching exercises. So it's advisable to take care of your joints regularly. It is a lifestyle. It's a way of lifestyle. It's not that it is it should be done only when you have an issue. So strengthening and stretches has to be done by everyone, and that's how they can take care of their joints for rest of their life. And also nutrition is also very important, and maintaining an ideal body weight is the best way to take care of your joints and to prevent the onset of arthritis as late as possible.
All right, Dr. Raghu Nagaraj there. Sir, thank you so much for speaking to us on Fever 104 FM. You shared a lot of interesting tidbits that will come in handy for everybody out there, because as we discussed at the very beginning, almost everybody suffers from some joint pain or the other. So thank you so much. I hope it was fun experience for you coming to the Fever Studios as well.
Thank you, Shan. It's always fun to come here and chat with you and talking to you guys. So I always love to be on here, and hopefully I'll get one more chance to come on here.
Hopefully we will have you here in the studio again soon. Thank you so much.
Thank you, Shan. Yeah.